Okay, good morning, class. So we are continuing with respiratory disorders in medicine. So last time we looked at tuberculosis. We defined what tuberculosis is. We looked at the predisposing factors, the signs and symptoms of tuberculosis, treatment and management. So today we are looking at a new condition, which is pneumonia. So we'll look at the definition of pneumonia. We'll look at the definition of pneumonia, the causative organisms, signs and symptoms, the types of pneumonia, pathophysiology. Then we'll look at the management, where we'll branch it into two of medical management and nursing management. So to begin with, we are looking at our first objective, which is the definition. So what is pneumonia? How can we define pneumonia? So pneumonia is the inflammation of the lung tissue characterized by cough, chest pains, dyspnea, and fever, usually due to bacterial, viral, or fungal infection. So this is the inflammation of the lung tissue characterized by cough, chest pains, dyspnea, and fever, and these are usually characterized by, or they are due to bacterial, viral, or fungal infections. So just a quick recap of the respiratory tree. We know the parts of the respiratory tree. So it has the primary bronchus, the secondary bronchus here, the tertiary bronchus, the bronchioles, the terminal bronchus, and the alveoli. So I would urge you to go through anatomy and look at the respiratory tree. So you need to know how to draw and label this respiratory tree. So having looked at that and defined pneumonia, pneumonia is classified according to anatomical structure involved or according to the cause. So this may be classified according to the anatomical structure involved or affected, or according to the cause. According to the anatomical structure involved, it can be called bronchopneumonia, meaning it's involving the bronchi, or it can be called Lobar pneumonia, meaning it's involving the lobe. And according to cause, pneumonia can be aspiration pneumonia due to inhalation of fluids, food, or vomitus in the airway, or hypostatic pneumonia due to inability, or rather due to immobility, or it can be called atopic pneumonia caused by less common organisms, or it can be called bacterial, viral, or fungal pneumonia, meaning that kind of pneumonia is either caused by bacteria, the viruses, or the fungi. Okay, so this is the structure of the respiratory tree. So we can see there that there are two lungs, the left and the right lung, the trachea there, the bronchi, and in the dark shaded part there, this is the part of the lung which is affected. What causes pneumonia? So we look at the causative organisms. So what are the causes of pneumonia? Causative organism of pneumonia. So on the causative organisms of pneumonia, just like we said on the classification, bacteria are the most causes of pneumonia, and examples of bacteria are Haemophilus influenza, the Streptococcal pneumoniae, Streptococcus, Staphylococcus aureus, the Klebsiella, then viruses. We have examples of the adenovirus, influenza virus, the fungi, the PCP, which is pneumocystic carine pneumoniae. Then protozoa, examples of a protozoa have the Mycoplasma pneumoniae. So those are examples of pneumococcal organisms there on the screen. So that's how they look when you put them under a microscope. Okay, so predisposing factors. What do you think are the predisposing factors of pneumonia? So the following are predisposing factors of pneumonia. One, a chronic bronchitis. We all know that chronic bronchitis, this is the chronic inflammation, or rather bronchitis is inflammation. So chronic predisposing factors, we have chronic bronchitis, the viral infections such as measles. So measles basically also affects the respiratory tract, and it also reduces the immune system. The other predisposing factor is inhalation of foreign materials. So this depends on what has been inhaled and where those inhalation has settled. The inhalated foreign materials can either descend into the lower respiratory tract and can cause pneumonia. The other predisposing factor is obstruction of the respiratory tract by growth. By growth, we mean cancers, which may lead to retention of fluids and secretion in the lung tissue. The other predisposing factor is prolonged cough. So prolonged cough can also lead to irritation of the respiratory tract, and this can reduce the ability of the cilia to propel the foreign bodies, and this includes microorganisms. So when you look at the pathophysiology of bronchopneumonia, first we need to understand what this bronchopneumonia is. So bronchopneumonia basically is the inflammation of the lung occurring in patches around the affected terminal bronchioles. So this may be confined to a small segment of the lung, or it may be wide, or rather a widespread to the whole lung or both lungs. So bronchopneumonia usually results from secondary to other infections such as measles, and this may also result from aspiration of oropharyngeal materials in the airway. So having defined what bronchopneumonia is, we look at the pathophysiology, what happens when organisms invade the bronchiole. So when the invading organisms provokes an overly exuberant immune response in the lungs, the capillaries, which are the small blood vessels, will become leak, and protein-rich fluid will begin to seep into the alveoli. When this occurs, it will result in a less functional area of oxygen-carbon dioxide exchange in the alveoli. So that exchange which occurs in the alveoli, it will cause the patient to be oxygen deprived. So the patient will begin to breathe faster and faster in an effort to bring in more oxygen and blow off more carbon dioxide. So when that occurs, when the patient becomes breathless, you find that they'll start now panicking to have more of oxygen, and they'll begin to try to breathe out or to blow off that carbon dioxide. So the mucus production will be increased, and the alveoli will fill further with fluid and debris from the large number of the white blood cells being produced to fight the infection. So you find that when this occurs, the normally hollow air spaces within the lungs will become solid due to those quantities of fluid and debris which has occurred. So here is just a diagram of what happens when someone has bronchial pneumonia. So this lung here, it has more of a carbon dioxide and less oxygen. So here, when this occurs, the patient will begin now to struggle for the oxygen which they need, and you find that they will start presenting the signs of difficulties in breathing. They'll start struggling for breath. Okay, so having looked at the first type, which is bronchial pneumonia, we come to the second type, which is lobar pneumonia. So just by the name itself, lobar pneumonia, it means that it's a type of pneumonia that affects or that may be confined to the lobe. So this is the inflammation of the alveoli, or rather the lobe of the pneumonia. So we'll also look at what happens when someone has lobar pneumonia. So as you can see there in the diagram, that's how the normal alveoli look like, and down there, that's how abnormal alveoli look like, those of a person or a patient with pneumonia. So signs and symptoms of pneumonia. What are the signs and symptoms of pneumonia? So one, if you recall very well, we said that one of the causes or the causative organism of pneumonia bacteria. So when there's an infection, a bacterial infection, the patient may present with fever due to infection. They'll have general body malaise due to tissue hypoxia. Anorexia will be present. This will be as a result of the inflammatory process. Joint or muscle pains will also be there due to tissue hypoxia. Nausea and vomiting will be present if the GIT is involved. Hemoptysis, which is a presence of blood in the vomitus, will also be present due to rupture of blood vessels. So if the patient is presenting with these clinical features, how are you going to manage this patient? So looking at the diagnosis of pneumonia, just like any other condition, when a patient comes to the facility, you need to do history taking from this patient, which will review stabbing in the chest, and this pain may be made worse by deep breathing or cough. So an auscultation may also be done. On auscultation, there will be reduced air entry and cracking sound in the affected area. Percussion, which is also another type of physical examination, can also be done. So when this is done, there will be dullness on the affected site due to some consolidation of the underlying lung. Diagnostic tests that may be done: Xray, sputum for microscopic culture and sensitivity will demonstrate the causative organism. Full blood count will also be done. So you find that when a full blood count is done, the white cell count will show elevated leukocyte count. Blood culture can also show the causative agent if bacteremia is present. Then chest X-ray will also be done, which will show some areas of opacity. So you see some white patches on the X-ray film, which will be seen. A CT scan or computerized tomography is another diagnostic test which can be done, and this can show pneumonia even where chest X-ray cannot. So moving on to treatment. If the infection was fungal, definitely you are not going to give antibiotics. So for fungal infection, antifungal drugs may be used to treat fungal pneumonia, such as fluconazole, and the dose to give is 100 milligrams, and this is given twice daily or BD for 7 to 14 days. Then to dilate the bronchioles, you need to give bronchodilators such as Ventolin. The dose is 2 to 4 milligrams, and this is given 3 times a day, or TDS. So apart from drugs, you also need to encourage the patient to rest to promote recovery, and you need to offer a balanced diet to boost immune system, thereby promoting quick recovery. And also to help loosen up secretions and bring out sputum, you need to offer a lot of oral fluids to the patient. Okay, so from there, you need to have aims, or rather objectives, of what you want to achieve in your management. So we are looking at the nursing care. So what do you want to achieve at the end of your nursing care? So firstly, since this patient has difficulties in breathing or has dyspnea, your first aim will be to relieve dyspnea, and also you want to promote recovery. So your second aim will be to promote a quick recovery, to allay anxiety, and also to educate this patient on their condition. So if this patient is admitted, you need to ensure that in their environment, they should be nursed in a Fowler's position to promote lung expansion, thereby relieving dyspnea. Also, you need to ensure that you change this patient's position 2 hourly to prevent the development of pressure aerosols. So you ensure that whatever intervention you do, it must come with a rationale. So as the condition improves, you let the patient adopt any position of their comfort to promote rest. So you also ensure that the patient is in a quiet room, basically to promote rest, and you can also ensure that related procedures are done in a block of time so as to promote rest, to allay anxiety of this patient. You need to ensure that whatever procedure is being done on them must be explained. So you also need to observe the progress of this patient. So under progress, vital signs will be done as these act as the baseline data in order to know if the condition is improving or deteriorating. So you ensure that you observe for cyanosis, if improving or getting worse, and give oxygen therapy whenever necessary. Also, since this patient has difficulties in breathing, you are going to observe dyspnea if present and ensure that the patient is propped up to promote lung expansion, thereby relieving dyspnea. Also, you're going to observe the pressure area to detect onset of pressure sore development. Still on observation, here you're also going to observe the sputum for color, amount, and consistency to detect hemoptysis. Since we said in the signs and symptoms that the patient may have hemoptysis, and this must be reported to the physician. So if the patient is in pain, you need to ensure that you observe the level of pain and also administer prescribed analgesics such as paracetamol to relieve pain. Then ensure to observe the feeding pattern of this patient and take measures like giving small frequent meals to promote appetite.